Jean, you asked about, it's a very good point. You said, how can I get physio? I keep asking them, they keep saying no. That's a summary of what you said. So basically, I think that's a real issue. It's a bit like what I said about exercise. Physio does not make CMT better because you can't make the wasted muscles come back. But physio, particularly educational physio, can show you how to do things and can teach you exercises to do on your own. The problem is, with the NHS at the moment, if you get referred to a physio, on average you get 6 sessions. That's just the way it is around the country. Now, there are exceptions to the rule, but on average people get 6 sessions. If you see a very good physio that knows about CMT, that may be enough to give you an exercise program that works very well at home. But if it's someone who mainly does arthritis and knees, it may actually not be very helpful at all. The problem at the moment is, because we don't know what interventions work specifically for CMT, that if we try to say someone needs more ongoing physio, they'll say, where's the evidence? So patients struggle a lot to get to see an appropriate physio. So I would say that every patient that wants physio is entitled to see them at least once, and they should ask to see a neurophysiotherapist. So a physiotherapist that has some experience in neurology conditions. I'm not saying specifically CMT, because then there may be very few in the country, but a neurological physiotherapist at least is used to dealing with balance problems, weakness problems, falls problems, and won't tell you to do silly things like go to the gym and do treadmill for an hour a day or something that's not going to work. So I think if you want, as a patient with CMT, if you want to see a particular medical person, I think you forget your own power. GPs cannot say no. They cannot. You're entitled to see anyone in the country for anything now, patient choice, but nobody tells you that. So nobody can say no. They can try, but they actually can't.
All I really wanted to do was to do the right thing to keep me active. And I don't want to be doing the wrong exercises. Sure. I just need someone to advise me. But they say I can go. I never get a referral. I ring the doctors, no referral. And it's been like that for about 10 years.
Sure. Well, I think you should just go and sit down one day in the surgery and say, I'm sitting here for the day. Bring a book and then see what happens. I think that's a really important question. That's one of the things we use our physios for quite a lot, is what exercise regime should this person be doing with these knees and these feet? Yeah. And often it's, just advice that I think you should go and sit down and say you're staying there till they do it.
A sit-in.
A sit-in.
Thank you.
That didn't come from me, by the way.
No.
Okay, let's move on then to Melvin Flax, please. Over the back there, yes.
You said 2 things. Does diabetes affect CMT, and does CMT progress? Now, in my opinion, CMT is slowly progressive. Now, I'm saying in my opinion, because it probably is the majority of opinion. There's been a study out of Holland that came out 2 years ago with CMT1A saying it doesn't progress in adults. Now, I don't agree with that. I don't agree with the methodology of the study, etc. So I think it does progress slowly. The diabetes does not as such affect CMT. The problem is, it's very common in diabetes to get a neuropathy. It's one of the commonest complications. And if you already have a neuropathy and then get another neuropathy, they will synergistically have more of an effect. So indirectly, having 2 problems to your nerves is more of a problem. So we do often see more problems in diabetics with CMT because of a diabetic neuropathy on top of that. So it's kind of that they add up rather than they make it worse.